Hi, my name is Jasmine Fennell. I'm a student nurse practitioner at Pennsylvania Western University, and I'm here doing my assessment. So I'm just going to start with hand hygiene and looking at a general inspection of Miss Chrisman. I note that she has no acute emotional or physical distress. She appears calm, clean, and well groomed. And to test cognition, can you just tell me your last name and date of birth?
Chrisman 2/14/05.
And why are you here today?
For a physical exam.
So at this point, I would take her blood pressure. She's been sitting for 10 minutes. I would have her raise. I would do this with her arm raised at the level of her heart bilaterally, and note that her blood pressures are normal at 114/72. Doing a head and face inspection, I'm noting that she has hair evenly distributed. She has a normal cephalic skull. She has no lesions, abrasions, nodules, or masses noted, and her facial features are symmetric. So I would just go ahead and palpate her skull now. And again, noting that there are no masses or nodules, and I don't see any lesions or abrasions. Moving on to the inspection of her ears. Both ears from the outside look symmetric and normal. I don't see any redness, swelling, drainage on the outer ear. To inspect the inner ear, I will pull her pinna up and back. And she has a normal tympanic membrane. She has no bulging or drainage of the inner ear. Redness or swelling is not present. Her eardrum was pearly in color, and there was no bulging in the inner ear. Now I'll perform a whisper test, just saying 3 words in one ear while she covers the other, and doing this bilaterally.
Red ball 5. Red ball 5.
Green 1 6.
Green 1 6.
So her hearing is intact bilaterally because she was able to repeat those words back to me. Inspecting her nose, it's symmetric. I see no redness or swelling from the outside. Her nares are symmetric and equal in size and shape. Looking inside the nose using my otoscope. Her nares are both moist. Her septum's midline. I see no erythema, swelling, or drainage in her nares. Moving on to the eye exam. Looking at her eyelids and the outer eye, there's no swelling or redness. I see no discoloration of her sclera or her conjunctiva, no jaundice. Everything's normal and intact there. Looking in at her pupils with light. Her pupils constrict to light bilaterally. Now I'll look at consensual response to light by looking in one pupil, by shining light in one while I look at the other, and those both constrict bilaterally. Now I'm going to put my finger towards your nose, and you'll just watch my finger with your eyes and then look at the wall behind me. So when I did that, when I pointed my finger towards her nose, her eyes constricted and converged, and when she looked at the wall behind me, they diverged and dilated, which is normal. Now I'm going to have you follow my finger with your eyes and don't move your head. So I note no nystagmus, her extraocular movements are all intact. So at this point in the eye exam, I can say that her pupils are equal, round, and reactive to light and accommodation. And if I had the ability to dim the room at this point, I would test her red reflex, shining the light in the back of both of her eyes and noting if that red reflex occurs. That should be normal bilaterally. When I'm looking at her eyes, I'm also looking at her vessels, and her vessels are intact and none of them are blown. Her optic nerve and macula also appear intact. Inspecting her mouth, just looking at it, her lips are pink in color, they're normal, they look moist. I'm going to have her smile for me and then puff out your cheeks. And then I'm also going to have you shrug your shoulders. Okay. So I'm looking in her mouth now, and her inside of her mouth looks moist. Her uvula rises and falls midline. Her tongue protrudes midline, and her tonsils were visualized with no inflammation or exudate. I'm going to palpate her tongue now and her top palate and lower palate. And both of those appeared normal with no masses or nodules. So now at this point, we've tested or observed all of the cranial nerves. Cranial nerve 1, olfactory, is smell, and she cites no problems with that. Optics is just optometry, and she has had an optometry appointment just last month, and I would use a Snellen chart if I were testing this today. Oculomotor is pupil width and eye movement. Trochlear is that downward eye movement and the cross-eyed eye movement. Trigeminal is testing for facial droop and sensation, which to test her facial sensation, I'm going to have you close your eyes. Tell me where you feel soft or hard touching your face.
Soft forehead. Hard chin. Soft right cheek. Hard left cheek.
So her trigeminal nerve is intact because she can feel those sensations and identify where she felt them. Abducens is number 6, and that's that extraocular eye movement. 7 is facial, and she's able to puff out her cheeks and smile. 8 is vestibular cochlear, which we tested her hearing. 9 is glossopharyngeal, which she can taste, and she's able to swallow for us, which I'll have her swallow later as well. 10 is vagus. She had a normal blood pressure, and she produces saliva in her mouth. 11 is the accessory muscles. She was able to shoulder shrug for us. And 12 is hypoglossal, which she's able to speak and swallow and move her tongue as I ask. Looking at her throat, it appears normal. Her trachea is midline. I'll be palpating her lymph nodes now. So we have the preauricular, the postauricular, the occipital, the tonsillar, the submandibular, and the submental. And then we have the interior cervical and the posterior cervical lymph nodes, the supraclavicular lymph nodes, and the intraclavicular lymph nodes. And when palpating these, not all of them are palpable. Some of them are slightly palpable, but there is no tenderness when I palpate. And all of her nodes are mobile and non-tender and less than 12 millimeters in size. Now I'll be palpate the thyroid gland. So I'm going to start in the front, and I'm just going to feel for her thyroid gland here, and then go to the back. And can you swallow for me? Okay. So she has no tenderness in her thyroid gland. It seems normal in size, which is about 4 centimeters by 1.8 centimeters would be the normal size of the thyroid gland. Now, palpating the carotid artery, I'll do this bilaterally, and I'll be feeling them one at a time. And her carotid arteries are about +2 bilaterally and equal with no thrills present. Now I need to listen to her carotid arteries. And I'm hearing no bruise on auscultation. Now I'm going to be listening to her lung sounds, both front and back and all lobes. Typically I would do this with the stethoscope to her skin, so she would be de-gowned or declothed for this, but for the circumstances, I'll do it over top of her clothing. So go ahead and take deep breaths for me. And her lungs sounded normal. She had a regular rate of about 17 breaths per minute. Her breathing was easy, non-labored, and clear. I heard no adventitious breath sounds, which include crackles, wheezes, and rails. I heard vesicular sounds throughout, bronchovesicular sounds interiorly to her scapula, and then tracheal sounds near her trachea. Next, I'm going to auscultate her heart sounds, including her aortic, pulmonic, Erb's point, tricuspid, and mitral valves. And when auscultating her heart sounds, I hear S1 and S2 normally throughout. No murmurs, bruits, or S3 or S4 sounds were present. S1 was greater than S2 at the apex, and S2 was greater than S3 at the base. Now I'm going to palpate her radial pulses bilaterally. And those are +2 and equal bilaterally. Her skin is warm, dry, and intact, and I don't see any lesions. Can you go like this with your nails? And looking at her nails, I see no clubbing. If I just pinch her skin a little bit, she doesn't tense, so that indicates hydration. Now I'm gonna palpate her popliteal pulses bilaterally, and those are +1 bilaterally. I would also palpate her femoral pulses in the crease of her thigh, and those should be about a +1 bilaterally as well. Inspecting her feet, I'm going to take off her socks here for a minute. Her dorsalis pedis pulse is a +1 bilaterally. Her posterior tibial pulses are a +1 and equal bilaterally. Her toes are painted, so we can't do capillary refill there, but on her fingers, it's less than 2 seconds and equal throughout, which means that she's well perfused. Coming back up, for a female patient, I would have her take her gown off to do a breast exam. I would just note on her chest that there's no redness, abrasions, rashes, or nipple discharge. Then I would have the patient put her hands on her hips, and you can go ahead and do this, and lean forward for me, and I would just be, you can sit up now, I would just be examining her chest in that position for tugging or pulling, which could indicate a mass under that tissue. At this point, I would have her go ahead and lay down for me, and I'll have you put your left hand above your head. Then I would palpate down her axillary nodes, and then counterclockwise around her breast tissue with the pads of my fingers. I would have her switch arms, and again I would palpate down the axillary nodes and around her breast tissue counterclockwise with my pads of my fingers, and I would note that there were no bumps, masses, or nipple discharge there. Next, I would calculate the point of maximal impulse. While the patient was lying supine, I would have her turn to her left side. I would place my hand on her sternal border, and I would palpate that PMI with my fingers. A normal PMI would be less than 2.5 centimeters diameter and brisk. I would also, I'm going to listen to her heart again while she's supine. And then feeling and listening, I note normal heart rate again, no murmurs, and I feel no thrills, lifts, or heaves in that assessment. Looking at her skin while she's laying supine and typically would be degowned, I would note that there were no lesions, rashes, or abnormalities, that she has even pigmentation that's normal for her ethnicity. If her skin is warm, dry, and intact, and if there were any abnormalities, I would note, document that with the A, B, C, D, and E system, which stands for asymmetry, border, color, diameter, and evolution or change. Moving on to the abdominal exam, I would have her keep her arms at her side and just lift her legs up for me. I would note that her stomach is flat and symmetrical in all 4 quadrants, that her umbilicus is midline, and I note no striae or lesions. If in a very thin patient or athletic build, you may note a normal aortic pulse just a little bit, and that is normal. Now I would auscultate all 4 quadrants, as well as the renal, femoral, and aortic artery. And bowel sounds are positive in all 4 quadrants, and no bruise present. Next, I would percuss the abdomen using 2 fingers and a tapping motion. And when I hear a tympanic sound, that means there's air present, and that's normal. And if I hear dullness, I'm over an organ or a bone. Next, I'll palpate. I'll start with soft, light palpation and then go to a deeper palpation. And I'm noting that there's no tenderness present for Miss Chrisman. Now to palpate and measure the liver and spleen, I would place my left hand under her right side, and then I would take my right hand and place it under her rib cage to palpate her liver and have her take a deep breath. And I would note that there's no tenderness, and I didn't feel anything against my hand, which means that there's no enlargement. Also, her liver size at the right mid-clavicular line, normal would be about 13.6 centimeters in a female that's 18 to 25 years old, so she fits in this category. I would do the same thing with her spleen on the opposite side and have her just breathe in for me. And again, no tenderness noted, and her spleen is of normal size. Then I would push on her right lower quadrant and assess for rebound tenderness, which I feel no rebound tenderness, and I observed none of that in her today. She also has no hernias or inguinal nodes enlargement present. Moving on to the musculoskeletal system. First, I'm just going to have her move her legs for me. I'm going to check for hip abduction and adduction, which her hips and knees do that correctly bilaterally. You can go ahead and sit up for me. I'm going to have you push on my hands and then pull on them, and then go ahead and push out and pull in. Okay, put your arms up, down, and you can go ahead and cross them for me. So I'm noting that she has no tenderness, no bruising present. Her elbows, her shoulders, knees, and hips appear to abduct and adduct correctly. I'm going to go ahead and palpate her larger muscle groups including her deltoids, triceps, and quads. And bilaterally, I'm noting that she does not appear to have any tenderness in these larger muscle groups. I'm going to have you go ahead and stand up for me now. You can bend down and touch your toes, and this checks for spine alignment, and her spine looks good. You can go ahead and stand up, no problems there. Now if you can put your arms up for me and just lean side to side, and this shows that her lumbar spine is intact and working correctly. Go ahead and move your neck for me, put it up, down to each side, and then roll. And she shows no stiffness or rigidity of her neck. I'm going to have you walk in a line for me then, and we'll test your gait. And her gait and posture looks normal. She's able to walk a straight line for us. You can go ahead and sit down again. And I'm going to have you touch your finger to your nose on both sides like this to test for your coordination. And her coordination is intact. Now go ahead and squeeze my fingers. And her grip strength is good. It's normal. She has 5 out of 5 grip strength. Her muscle strength in her legs, arms, the pushing and pulling is all normal. +5 muscle strength. Full range of motion against gravity and maximal resistance there. Moving on to her deep tendon reflexes, I'll be doing these with my bell of my stethoscope. So I'm going to have you have a square arm for me like this. And testing her tricep reflex. And that's a slight reflex reaction, +2 bilaterally. Now I'm going to test your radial, so you can go like this. And her radial is about a +2 bilaterally as well. And then brachial, if you can flex for me, and then go ahead and let your weight down. And brachial with the arm bent and flexed is about +1. It's a slighter reaction. Next, I'll go to the patellar just below the knee. And the patellar is +2 and equal bilaterally. And then Achilles, you can rest your foot upward for me. And that Achilles reflex is a +1, and it is brisk, a brisk response in all of those reflexes. And that completes our physical exam for today.